All right, this is a very important video about chest pain. I personally have been to the emergency room 3 separate times because I had chest pain. Now, I'm going to tell you, and Mike is going to explain how I got chest pain, and more importantly, how I got rid of it.
Now, chest pain can obviously be from the heart, which can be a fatal situation. So it is important to go to your doctor and get a proper diagnosis.
Right. Now, once you are certain that a doctor has ruled out that your heart is not the problem, then you can come into this video and we're going to show you the details and how you can fix it without a big effort. Now, I found out on my 3rd visit, the ER doctor said, don't worry, there's at least a 50-50 chance that is not your heart. And he said that's from his experience. And I've looked into it, and typically that's what you'll find. Oftentimes it's not the heart, and a good relief.
Now, there are 3 common causes of chest pain you can experience not heart-related, and that is GERD, or also known as heartburn for some people. It is also a musculoskeletal issue, or it can be caused by anxiety of sorts.
Right. Now, doctors are good at helping you with anxiety or with GERD, in other words, the heartburn, with medications. But musculoskeletal, which was what I was diagnosed with, they really didn't have an answer. And I thought, well, I'm a physical therapist. This should be right up my alley. And I did not have an answer myself. So after doing some research on the internet, we found a physical therapist actually from New Zealand who actually had the same problem, severe chest pain, really interfering with his life, and it was not from his heart, it was musculoskeletal, and he actually found the cause and, more importantly, how to fix it.
So we actually interviewed Steve August in the past to talk about this issue very much in depth and what tools you can use to help fix it.
That's right. So I'm going to give you the long story short on what causes musculoskeletal pain in your chest right here. Now, when I have it on the right side, it's where the ribs connect to my sternum. That's why we have Sam here. How you doing, big guy? All right. So here is the source of my pain. It's where the ribs connect, and they're actually cartilage. And it's cartilage where it connects to the sternum, and there has to be movement there, okay? Not too much. And what actually happens where the pain comes from is from back here where the ribs connect to the vertebra. Okay, we get a close-up here. Mike is pointing to where the joint is, where the rib connects to the vertebra. Now, when you breathe, the ribs expand and they go down. So there has to be motion, and that motion needs to come from that joint. Look at this. So when you breathe in, it goes up, and when you breathe out, it goes down. If this motion becomes locked up, what happens is the motion has to come from somewhere so you can breathe, and it actually comes from the front. There's some arthritis in this area. When you get that moving, it causes pain, and you have pain, and it's very tender. Now, there's a nice way to help determine if you know you don't have heart pain. In my case, what I do is I start to palpate or push in and see if I can find a sore spot. Now, I've had 3 or 4 doctors actually do this to me, and they would push around, and they really, good doctors, but they weren't real good with assessing this particular diagnosis. I found if I would work in there, there'd be a point about the size of a dime, and it would be really tender. If I push on it, that would be the hot spot, and that spot would take the pain and it would radiate out. Very clear, it's not from the heart, it's from that point. So we need to break this up to take the stress off the front where the rib connects to the sternum and relax it, and the pain goes away. It's worked out quite well. Let's show you how it works.
So the condition Brad is talking about is called costochondritis, and in order to treat it, you will need one of 2 things, either a soft ball if you have one available, and if that happens to work good, you can get a back pod, which is created to treat this issue.
Right, so Steve August actually got very involved in creating this specifically for this problem, but the good thing about it is there are other conditions you can treat with it too, as side joint, back pain, hip, so it's not just for costochondritis, but this is what I use, been using it for years with great success. Now let's show you how to use it. Now the treatment is actually done lying on the floor on your back. I'm going to show you on Mike the locations along the rib cage in the back where you actually put the pressure. So if you're using the ball or the back pod, we're going to start out we're going to start with Mike on the right side. That's where my pain is, so I work the right side, but I also work the left side for maintenance because I want to make sure it's clear throughout. So we'll start out lower. We got the shoulder blade here where the ball is. We're going to go just below that, just to the right of the spine. You do not go on the spine. It's that muscle between the spine and the scapula or the shoulder blade. I'll work it here, then I'll go up, and I actually go 4 locations, and I do the same thing starting low, 2, 3, 4. It takes me about 2 minutes, and I'm done. So let's go down to the floor and get the details. Now, if you're using a tennis or a softball, you could try a baseball. Softball is probably better, it's a little bigger. This can be fairly aggressive. So I'm gonna show you with the back pod. But if you got the ball, it's the exact same thing. You just replace the back pod with the ball. Now, the first time you do it, I would take a towel, fold it up so there's 4 to 6 layers, whatever it takes, because it's going to be a little uncomfortable on your back more than likely, unless you're used to something like this, which most people aren't. Towel on there gives you a little comfort. And now I'm going to go down on the left of the spine, just below the shoulder blade. There we go. Again, I do it on both sides, although the right side is my involved side. And you're going to lean back into it, and then you can work forward and backwards, and we're mobilizing that joint where the rib connects to the vertebra. Now, what Steve likes to do, he says, emphasize it with taking your arm and going up over the top of your head. You can do both arms at the same time. It's a little more aggressive. To start out with, you may just want to do one arm. Extend and arch and go back and do that a few times. And after I did this for a couple weeks, I started to actually go back and forth, and it helps mobilize that joint, and it actually does some good myofascial stretch. I don't know if that does anything for the costochondritis, but it sure feels good on my back. So after you do that in all the locations and you're done, now you'll get used to it after a while. You can take the towel, set it off to the side, and you'll feel the difference. And this is where it really gets into those joints and helps mobilize it and break that arthritic joint up, get it moving. And again, like this and back. And what I typically do, like I mentioned with Mike, is I'll finish with one after a few repetitions, and I'm going to slide down about 2 inches, get the ribs upwards or towards the neck, and do this. I typically go with one arm. You can go with both. Sometimes I'll really get aggressive. And, you know, I did not like this at first, and actually now I look forward to doing it because it just makes everything feels good. I know Bob has done it. It's great for your posture as well. I'm going up to my 3rd area. Now, I do go all the way up to my upper trap. Doesn't have anything to do with my costochondritis, but boy, does it feel good and get those muscles relaxed, help the posture, and I'll work back and forth. And that really does a nice job in that area. And they'll do that on both sides. This is that simple. You need to do it daily. And if you got that costochondritis pain, you should feel relief easily within 1 to 2 weeks. So, boy, it is a real nasty experience when you have that chest pain and you're wondering, is this a heart attack or is this costochondritis? Get rid of it. Use this, and then you don't have to think about it. That's been my experience, and I wish you good luck with it. Mike, do you have anything to say?
Oh, the videos. If you'd like to purchase one of the back pods, we will link it down below through Amazon where you can find them. Steve August gets the commission from these. We do not make them ourselves. If you would like to learn more information about costochondritis, you could check out the interview Bob did with Steve a while ago and learn a lot more information than we can give on it.
That's right. I highly recommend watching that whole interview. Steve is just a wonderful man, and he's very sincere about what he does. He actually gives these in-services to physicians to educate them. He's way out there in regards of the physical therapy world with this topic.
Bye.
Bob and Brad, the 2 most famous physical therapists.